When you come for your consultation appointment with me, I would go over all your skin, including where the lines are, what the elasticity of your skin's like, what the colour of your skin's like, what the health of your skin is like generally. And then with the aging process, what tends to happen is the fat compartments of our face, which are underneath the skin and all in different levels and also different areas of skin, they all drop down, like most things with age. It will all drop down, which is why babies will have much plumper cheeks, or even into your 20s, 20-year-olds will have much nicer cheekbones, they'll have much curved, all their face will be quite curved. And what happens with age is you lose those curves, and that's what gives away the signs that you are aging. So with Kathleen, although I'm aware that there's other things going on, I'm not going to look at that today, and I'm just going to address the lines. The other thing that most people have done, so 3 main areas that you would have Botox would be the forehead lines, between the eyebrows and around the eyes. And I think it's important to say that as you age, there is a bit of a trade-off. If you have your forehead done, there is a chance that your eyebrows will drop down, which is not a sort of look that most women want. Men, they don't mind that, but with women, we generally want our eyebrows to be a bit more raised, so that the eyes open up a bit, because again, that's more youthful looking. So when we assess, if somebody says to me, actually I really want the lines in my forehead looked at, I would need to really question whether by relaxing, because all the toxin, actually I should say, what the toxin does is, it relaxes the muscles, so it's a muscle relaxant. So this muscle here will be relaxed, the muscles in there will be relaxed, and the muscles around her eyes will be relaxed. So this muscle here normally tends to pull up, so that's why when you raise your eyebrows up, that's the muscle that's working. And with this bit here, if you become really angry looking for me, that's the muscle there that's pulling everything down. So if we treat this muscle, and you're already quite dropped down, then there's a tendency, if you're relaxing it, there's nothing pulling up anymore, so it's going to fall down even more. So that's what you need to be really careful about when you're getting your forehead treated. So with Kathleen, what I've discussed with her, that is because we want a bit of an eyebrow lift and our eyes to open up a little bit, I'm not going to treat the forehead at this visit. I am actually going to just treat in between here and around the eyes. And what that'll do, hopefully in the next, anything between 4 days and 2 weeks, you'll start to see the results where the eyebrows will start to lift and all these muscles will start to relax. It may not get rid of all the lines altogether, but it will definitely smoothen them out. So what I'm going to do is I'm going to mark Kathleen as to where I'll be injecting, just so you guys, well, I do this generally with any assessment, but it makes it easier for you guys to see what I'm doing as well. If you just make a really angry like face where you're really, I know you can do more than that. Like with your eyebrows here, I want you to tense that, but that's it. So can everyone see I've done 5 dots there? One in the middle, that's your strongest muscle there. And then what we know with the Botox is there is about a centimetre circle that it kind of spreads out to. So what we're trying to do is cover the most amount of area with those dots. So every centimetre we know that's going to cover. Now the danger zones with this is anything, if I just look at Kathleen, sorry, just look straight ahead at me. Straight ahead. No, just look at me. That's it. So what I'm doing is marking where her middle of her eyes are, this mid-pupillary line, because I don't want to be hitting anything past that. So can you see, I'm not going to be injecting in there. Those are my areas. So if you get injected in these sort of areas, you can have a little bit here, but if you're injected any decent amount of material in this area, you've got a really high risk of getting side effects. So can you see how that's how we limit the side effects of when we do the Botox. If you like smile for me, that's it. So this time I'm just making sure that I'm a good distance away from her eye, which is about 1 centimetre normally that we're aiming for. And then again we do 1 dot above and 1 dot below. And because I'm going to catch some of these ones, I'll put a tiny little dot in, not very much, but just a tiny little dot on that side. won't see the effects of this straight away. It will take at least 4 days. Some people get it in 2, but you won't really see the maximum effects for about 2 weeks. So it's not something you do instantly and then see straight away. One of the side effects with this is that it can cause a bit of bruising just because there are little vessels all over the face, and especially around the eye where I'm going to go now.
Honestly, it didn't hurt and I wouldn't tell you why, because I'm a biggest poop for needles.